Hi, my name is Emma Sandgren and I'm from the Karolinska Institute in Stockholm, Sweden. And today I'm going to talk to the trial considering AF. Current European guidelines recommend considering systematic AF screening in individuals aged 65 years or older with additional stroke risk factors. And our thought was that some kind of enrichment aimed at target screening for individuals at highest risk of developing AF will potentially improve the diagnostic yield. Therefore, our aim was to test whether the combination of our risk prediction model developed using machine learning together with long-term ECG recording was superior to standard of care in detecting new cases of AF in a population aged 65 years or older. The trial design was a randomized, controlled, cycless, non-blinded superiority trial featuring 4 parallel arms, 2 intervention arms and 2 control arms. And the target population for the trial was residents in Region Halland, Sweden, aged 65 years or older, without a diagnosis of AF in their electronic health record. And the exclusion criteria were having AF, having another indication for anticoagulation treatment, having dementia or an implantable device. Key findings of the trial was that in the tension tone white analysis, the incidence of AF after 6 months in the RPM intervention arm was significantly higher than the incidence in the general control arm, 3.8% versus 0.7%, which means an absolute increase of 3.1%, a risk rate of 5.6, and a median number 2 in white of 32. The result was also significant in the per protocol analysis, with an AF detection rate of 6.3% in the RPM intervention arm. And additionally, in the per protocol analysis, both of the components, the risk prediction model and the long-term ECG recording, showed significant results, indicating that both components were important. The AF yield depends on both the duration of the monitoring and the prevalence in the target population. And in this trial, we wanted to target individuals with highest risk of developing AF. And it's also these individuals who will benefit the most for anticoagulation treatment. Interestingly, 76% of all cases of AF detected with the ECG patch were identified within the first 7 days of monitoring, suggesting that these individuals, high-risk individuals, have a significant AF burden, which could indicate that 7 days of monitoring may be enough in a population like this, but maybe rather repeat the screening in individuals where AF is not initially detected. The combination of a risk prediction model and long-term ECG monitoring was superior to standard of care in detecting new cases of AF in a population aged 65 years or older. The participation rate was high for a digital screening study. The overall participation rates in both intervention arms were 42%. But the AF detection rate was low in the general non-enriched cohort. Yeah, although target AF screening was efficient in finding patients with unknown AF, the benefits of finding these patients needs to be verified with regard to clinical outcomes such as AF-related strokes. Additionally, health economic consequences and the effect on healthcare consumptions need to be evaluated for target AF screening, even though AF screening has the potential to reduce future AF-related strokes. Finding these AF cases is related to a cost and at least temporarily increased healthcare consumption.